We're in Module 11, Exemplar 11B on seizure disorders. Module 11 is intracranial regulation. Okay, 11B, seizures, and we're just covering the pharmacology end of it. The purpose of them is to reduce or control most seizures, protect patient from harm, and prevent seizure activity without impairing cognitive function. And see, the key there is reduce or control. It doesn't mean they won't be seizure-free. The lowest possible dose of a single medication that controls the patient's seizures. Sometimes they have to do combinations. Your text has a little box of anti-seizures on the bottom of page 764. There's a whole list of names and some other information. That's about all it has on it in your textbook. So let's start with Heidentoin's phenytoin. Obviously, Heidentoin, phenytoin. It is the only in this class. It is very common. Phenytoin dilantin, you will see. Comes oral and intravenously. I should have put a picture in there on your gingival hyperplasia. Gingival hyperplasia, biggest thing. Well, I used to have a picture, and I don't know why I didn't do it here, of the hyperplasia of the gums and the teeth. That's the biggest thing to remember with this. Lethargy, abnormal movements, mental confusion, and cognitive changes are possible adverse effects, but a biggie with the gingival hyperplasia. It's used for tonic-clonic seizures and partial seizures. Tonic-clonic is what we used to call grand mal seizures, where the whole entire body is involved. They now call it tonic-clonic, or partial seizures where part of the body is involved. In other words, it's not for absent seizures. Contraindicated in heart conditions and bradycardia. Therapeutic levels. All of these seizure drugs will have a therapeutic level. It needs to be there to be therapeutic, and toxic if it's above it. Being familiar with the name of the drug, like phenytoin instead of dilantin, and when we get into the others, because when you have to draw drug levels, look for drug levels, order drug levels, you're going to have to look for the generic name, the drug name, not the brand name. I remember I used to struggle with that on these. So know these therapeutic levels on these, especially dilantin, which is a very common drug. Cautions: low albumin, malnourished, and chronic renal failure. It is, why do you think low albumin? Well, albumin is your protein, and this is a very highly protein-bound drug. So if somebody has a low albumin, such as the really, really young, especially the elderly, the malnourished, they're going to have less albumin. So since this drug is mostly bound to protein, if they don't have enough albumin or protein for it to bind to, more of it is available in the bloodstream, so they can easily have toxic effects, so they may need lower dosing and close monitoring of drug levels. Only dilute with normal saline, only dilute with normal saline. You will do it. I've done it. Well, now there's so many pharmaceutical things in place where they'll put stickers everywhere and probably attach the saline to as your dilutant. They'll have something. In the old days, we used to do it if you grabbed D5 or something, or you had an IV of D5 going and you went to hung a piggyback of phenytoin or dilantin. Oh man, it formed a rock as soon as those two came together. Very, very irritating to veins. So nursing things, you're watching the vein. If somebody complains they have phenytoin going IV, and you may have to dilute it more, you may need to give it a slower rate. You're going to watch for, what's the word? Phlebitis, inflammation of that vein itself. So you're watching for that. Okay, phosphenotoin, Cerebix. It's been away from the bedside a while, but I hadn't seen it used as much before, but it's a prodrug of phenytoin. It's good because it can be given intramuscularly and intravenously, where phenytoin can only be given, wait. Yes. Phenytoin is given orally and IV. This is given IM and IV only, and it's a derivative. It when it gets into the body, it converts itself into phenytoin. Is the best way I can describe it. No vein irritation, but there is black box warning for hypotension, cardiorespiratory depression, and ataxia. Those the jerking of the body. So those are black box warnings. But it is a prodrug and can work much more rapidly than your phenytoin. Okay, barbiturates are used for seizure management. The only barbiturate is your phenobarbital. It's oral, IM, IV. Adverse effects are dizziness, drowsiness, lethargy, paradoxical restlessness, and GI upset. So your paradoxical restlessness, often seen also with benzodiazepines like your Valium and Xanax. Increased talkativeness. Paradoxical, it's the opposite of what you expect. You expect everything to be drowsy, lethargy, to be downplayed, but they have paradoxical. Increased talkativeness, emotional release, excitement, excessive movement. So barbiturates, phenobarb actually is a drug that is abused out on the street also. So you're watching too for unsteady gait. Yeah, I think that's it. And okay, more on your barbiturates. It is used in your tonic-clonic, partial seizures, myoclonic seizures, and status epilepticus. You should have your lecture on your seizures, which should go into all these types of seizures. So it's multiple types of seizures, contraindicated in liver or kidney impairment because it is metabolized in your liver and excreted in your kidney. Contraindicated in respiratory illnesses because here, when it's slowing everything down, they're lethargic, drowsy, they're not taking those deep breaths. So it's a contraindication to down them. You would call it, I would call it barbiturate a downer. Contraindicated in pregnancy. Here's your therapeutic level, 20 to 40. Remember, phenytoin is 10 to 20. Barbiturates, phenobarbital is 20 to 40. And wean off slowly, or they will start seizing and having major withdrawal problems. Primidone is another mycelium used in seizures, metabolized by the liver into phenobarbital. So it's like here, if I go back, it's like your phosphatidylphenytoin, which is made into a phenytoin or dilantin with metabolism. And so with your primidone, it's broken down by the liver and becomes a phenobarbital, and it's only given orally. Adverse effects are the same with your CNS depression, paradoxical excitement, dizziness, ataxia. The only difference here is your possible rash. But the rest is the same because it breaks into the same drug. Carbamazepine. It's the only in this class of the imostibines is your carbamazepine, or you may know it as Tegretol. But if they're on Tegretol and you have to drop a level, you're going to be doing the carbamazepine on your level. Adverse effects, dizziness, blurred vision, headache, hyponatremia, and leukopenia. Hyponatremia and leukopenia. Your therapeutic level is 4 to 12 for carbamazepine, which is your Tegretol. It's only used in tonic-clonic and partial seizures. Big contraindication, bone marrow depression. So you look here, that's why you're seeing leukopenia, because of the bone marrow depression. So there's your contraindication and your adverse effect going hand in hand. Valproic acid, Depakine or Depakote. Again, when you're looking for your lab value, you're looking for valproic acid to order it, not your Depakote, which that was the one I had the hardest time with. Remember to order it or look for results. I'm looking for valproic acid, because that's the brand name or the drug name for Depakine or Depakote, oral or intravenously. Again, they're suppressing the central nervous system, so it's drowsiness, nausea, vomiting. Biggie on weight gain. I've seen that when they've given Depakote often as an adjunct with pain management or with mental health disorders, common mental health disorders like a bipolar and a significant weight gain. Hepatotoxicity and pancreatitis. Watch those blood sugars, watch those liver enzymes, watch your amylase and lipase. Hepatotoxicity and pancreatitis. So if I were to ask you about lab monitoring or what you teach in the patient, that should come to your mind. They're used for absence seizures, where they kind of get lost for a second, myoclonic and tonic-clonic, which is your grand mal. Very, very highly protein bound. So what are you watching for? You're going to not give it or use caution if you're giving it to somebody that has a low albumin, just like your phenytoin or dilantin. Contraindicating liver impairment, because that is where it's metabolized. So if it's contraindicating liver impairment, you're watching for alcoholism, hepatitis, any problems with the liver. Broad therapeutic level of 50 to 100. Some others, your gabapentin and lamotrigine. So your gabapentin or rotten was mentioned in your pain management. It used to be used quite often adjunct treatment of partial seizures, but quite often in pain management. It has been found to be very, very addictive, abused on the street. Although it's not a narcotic, it is now classified as a controlled substance, at least in the state of Tennessee. It's a class 5, so you have to get a script, a controlled substance for it, just because of the level of abuse, because central nervous system depression, and it can cause some GI symptoms with some nausea, decreased appetite. Lamotrigine or Lamictal is used for general seizures, adverse effects, minor CNS and GI symptoms. And this is used very often. You'll see lamotrigine or Lamictal used with like bipolar or even some schizophrenia. It's in conjunction with your mental health drugs, and gabapentin more so with your pain management, but that's on the decrease because of people and their abuse. And that is it for your lecture on your seizure drugs.